and 95% you guys are normal, right? So think about that for a second. What if all of those people are not really normal? What if they're doing a test and they're averaging in a lot of abnormal people? Let me give you an example. If you were to look at a distribution of the normal weight of an American, North American from the United States, um, if and you were to go back to 1950, you would have a 95% confidence interval in the distribution, and your underweight people would have a body mass index of like less than 10. And your overweight people would have a body mass index of over 20 or so. And then you take a normal distribution curve from today, and your weight would be considerably higher. And they would say you're normal because you're in that 95% confidence interval, even though you're actually obese compared to a 1950s person. Does that make sense? So that's the same thing we're dealing with diabetes, is that we have a distribution curve from the lab. And the lab is saying, well, all of these people are normal. They have a normal amount of insulin resistance, a normal amount of blood glucose, your hemoglobin A1C is normal. But what does that mean exactly? Well, it means you're average. Well, in this kind of a case, you don't want to be average. Average is not good. Average is technically diseased, like the average American has a disease that we call insulin resistance. And so this is not a minor problem either, because it leads to a lot of other problems like Alzheimer's disease and kidney disease and liver disease. And so these are things that are degenerative because they're even though they're technically normal. So you don't necessarily want to be normal. What you want to be is optimal. So that's what the way you want to look for. What is optimal? Okay, so in a hemoglobin A1C, you're looking at that number, and they tell you that 5.7 is pre-diabetes, 6.5 is diabetes, and then up from there, you're in the diabetes range. But what is optimal? Well, optimal is really 5.0. And if you just look at the difference, I saw a study on the difference between 5.4 and 5.8. That difference is, so people who were at 5.4 had half the death rate, the mortality of people at 5.8. And that's not a big difference. So, the fact that your 5.8 is pre-diabetes, and you go, well, it's not diabetes, so it's okay. No, it's not okay. That's still a risk factor, and it's a big risk factor. It's not a little risk factor, because it doubles your risk of mortality. So the perfect place to be, the optimal place to be, is right around 5.0. So 4.8 to 5.2, anywhere in there is fine. I find that people who are lower than 5.0, they're in the 4 point somethings, they often have hypoglycemia, low blood sugar, because of high insulin. And so make sure you look at your insulin, because if you were to be like, let's say you're 4.8 and your doctor goes, oh, this is great, your average blood sugar is 95. That is so good. That is excellent. Because 70 to 90 is optimal. But you didn't test your insulin, so you don't know that your insulin level is 25 or 26. And that's pushing your blood sugar down, but you have insulin resistance. And because of your high insulin, you can't use fat efficiently for energy. And so you're going to get heart disease. You're going to get brain disease. You're going to get fatigue and weakness and brain fog and all of the problems associated with high insulin levels. So it's not necessarily good just because your hemoglobin A1C is good. You have to get the big picture. You have to look at the whole thing and say, okay, What is your blood sugar fasting? What is your hemoglobin A1C? What is your insulin level? And then I always look at C-peptide also because it gives you more of an average instead of the immediate insulin level, that second. So that's the way to look at hemoglobin A1C. And when you look at other tests, that's kind of the way to look at it too, is what's the big picture and what's optimal. So hemoglobin A1C, look for 5.0, but look at your other tests too. Did you have
Now you
another?
mentioned the
Yeah.
fasting blood sugar or glucose, you said between 70 and 90, correct?
Yes.
Okay, so a lot of times we get questions from people that say, well, when I eat, right after I eat, it goes to like 100. Is that okay?
Yes, that's okay. That's okay
Okay.
right after you eat. So we're looking at fasting levels between 70 and 90. And after you eat, if it goes up to 100, even 110 is not an issue. If you're starting to go up 120 or higher, that's an indication of insulin resistance. And then when people have a fasting blood sugar, that dawn effect, the morning effect, the cortisol goes up in the morning and makes you insulin resistant. And so your blood sugar goes up. But so if your fasting blood sugar is higher than between 70 and 90, that still means you have insulin resistance. So that it's not, you can't just say, oh, that's the dawn effect, doesn't mean anything. No, it means something. It means you have insulin resistance. And the cortisol is bringing that out, is making it obvious.
Okay, so you also said recommended getting your fasting insulin checked. What should that be?
Okay, so the fasting insulin should be right around 5. If it's as low as 3, that's okay. If it's as high as 7, that's okay. So somewhere around there between 3 and 7, optimal being right around 5. And then being up to 10, it would be normal. But over 10 is high if you're fasting. And then it goes up from there. I've had people over 100,
Mm.
and that I can't imagine a pancreas pumping out that much insulin. But wow.
How about C-peptide?
Okay, C-peptide is 1. So it should be 1. So if it's 0.8, that's okay. 1.2, that's okay. And think of it on a scale. Where the optimum place to be is right here, 1. If it's 1.2, that's okay. 1.4, you're getting a little higher. 1.6. If it's over 2 on a fasting specimen, you're making a lot of insulin. And the reason the C-peptide is also important, let's say you're injecting insulin. How do you measure your insulin level if you're injecting insulin? Because, some of it is long-acting insulin, and you got this long-acting insulin, and you're taking an insulin level, and it's 50. And you're going, okay, is that what I injected? Or is that what my pancreas is making? I don't know. So the only way to know is the C-peptide, because the injected insulin has no C-peptide at all. And so if you inject insulin, your insulin level will go up, but the C-peptide will not change. So that's another advantage of doing the C-peptide is that's coming from your pancreas, only from your pancreas. And so if you're injecting insulin and you have a high C-peptide, that means you're injecting insulin and your pancreas is also pumping out a whole bunch of insulin, a lot of insulin. So having both of them elevated means you've got to do something about that. This is not a lack of insulin problem. So injecting insulin is not a wise thing to do.
Is that still something? I mean, I hear a lot of people are on insulin. Is that kind of I don't know how to say this. Are people getting insulin without getting that checked?
Yes, almost everyone. In fact, I read an article by an endocrinologist, specialist in diabetes, who said, yeah, I never check insulin levels because it doesn't make any difference. We just have to lower the blood sugar one way or the other. But if you don't know the insulin levels, you don't know if your pancreas is functioning or not. And you don't know if you're in how insulin resistant you are or not. You need that insulin resistance index to be able to determine, okay, this isn't not a lack of insulin problem. This is an insulin resistance problem. So injecting insulin is counterproductive if it's insulin resistance problem because you're resistant to it. So you're just going to become more resistant to it. And that's the same thing with, like these peptides that everybody's using, Wegovy and all that to lose weight and to decrease their blood sugar. Do you know how it works? Well, number one, it slows down your stomach so you don't feel like eating anymore. But number two, it increases insulin production. So it will actually make you more insulin resistant over time. So that's a danger of those medications as well.
Okay, so there was a message here that came through. Let me see. Sue said, these numbers have been drastically reduced in the past few decades. 7.0 A1C used to be good. Now the doctor wants you at 5. Is that? I've never heard that.
Yeah, 5 is perfect. I've never heard, I didn't, 7.0, there was, I don't know, what was it, 5 or 10 years ago? They weren't using A1C for diagnosing or using A1C as a measure of diabetes. The A1C was just a measure of how good your control was. And so now they're looking at it differently and saying that we're actually using A1C to diagnose diabetes. So it wasn't diagnostic. So it was fairly recently that they came out with, okay, over 6.5 is diabetic, 5.7 is pre-diabetic, and optimum is 5.0. So yeah, at one point, the endocrinologists were saying, well, you have moderately good control if you're below 7. And so, yeah, that was, but it's changed. It has.
Yeah.
They're right.
Okay. Very interesting. Okay, so let's talk about Manja had said, what do you do to treat insulin resistance?
Okay, good question. So the question then would stimulate a discussion of why you would become insulin resistant. And so your cells, this is on a cellular level. It's like you have 60 trillion cells in your body, and all of them need energy constantly. And if they're lacking energy, they're going to die. So this is important. They have to have enough energy. So these cells, especially like liver cells and muscle cells, they're storing glucose. So you eat a meal and all this glucose goes up. And then your pancreas makes a bunch of insulin and says, hey, we got extra glucose. You guys can bring in some extra glucose. And so these cells have a whole bunch, thousands of insulin receptors on them saying, when there's extra glucose, let me know because I want some more glucose. And so then the insulin comes along, grabs on, pulls the glucose into the cells. And then you eat more and you can pull more glucose into the cells, more and more. And so now the cell has a bunch of glucose and it starts making something called glycogen, which is a starch. And so it's storing this glycogen. It's filling up and filling up and filling up. And when it gets full, okay, we're done. We have more glucose than we can handle in here. Then the nucleus stops making insulin receptors. So now you have a cell with 0 insulin receptors. It's completely wiped clean, no insulin receptors. And so now you eat sugar and then you make a bunch of insulin, and insulin's coming around going, hey, I don't have any receptors anywhere. And looking on these cells and those cells and that cells, and that's called insulin resistance. And the whole reason is because the cells are filled up with sugar, so with glucose. So 2 things have to happen. Number one, your cells have to use up the glucose that they have. And there's a couple of really good ways of doing that. One is exercise, because most of them are muscle cells that are storing glucose. And the second one is fasting. So if you exercise a lot, then you're using up the glucose in your cells. So I don't know if you remember, what was it, Michael Phelps? Like he's swimming like 5,000 calories a day, right? And so he has to eat that much. And so for breakfast, he's having like 25 stacks of pancakes and I don't know, a whole bunch of stuff. And everybody's going like, wow, man, he must get fat. No, he's actually burning all of that. So his cells are filling up and used up, and then they're filling up and used up. And when they get used up, they make more insulin receptors to say, hey, we need some more glucose when you got extra. So he eats a whole bunch and he goes, oh, great. And then so they suck in all the glucose and his blood sugar never goes up. In a 5,000 calorie meal, all glucose, like pancakes with syrup poured on them, and the blood sugar never goes up. Why not? Well, because the cells are sucking in all that sugar because they need it. So when you're not exercising and you're eating 3 meals a day, it's really easy to just fill up those cells and become insulin resistant. So number one, use up that sugar, exercise. And the more you exercise, the better, period. There's no downside to that. And then number two, eat less sugar. And that would be eat fewer meals. Fasting is a great way to do it. It takes about 2 days, depending on how much exercise you're doing. For some people, it'll be a little more. For some people, it'll be a little less. 2 days of drinking water only before you use up your glycogen stores in your body.
Wow. Okay. Lots of good questions here. Let's see. I thought this was a good question. Anonymous had said, do you have any menu examples of what 20 grams per day carbohydrate meal looks like for the 30-day detox? And I just want to mention that in the Diabetes Solution Kit, we do lay some of this out. You can look up some meals that tell you, how many carbs are in each meals. I had a conversation earlier today with someone. I said, my favorite thing to do is just Google some recipes, look up some low carb recipes. If you know you like something specific, maybe you're like, I really love burgers. I don't know. Look up a low carb burger, okay? Or look up those kind of things. You're going to get some really good ideas. I think we have some uh, pancake recipe that we have in there. We have omelets, we have ceviche, we have, oh man, lots of different things. There's low carb pizza that you can make.
Salmon
If you're
salad.
yeah, if you're okay with
I love
dairy,
that.
I mean, you can find lots of good options. And so I would just encourage you to do that. Or you can also find that book at bartonwebinar.com and use code webinar25. You'll save 25%. Okay, webinar 25 is one word. All right. Another I was going to say another lab work. Another lab result that we want to talk about is cholesterol. How is our cholesterol checked and what should it be?
Okay, so cholesterol is a big issue because of marketing. So there's a drug company that makes a drug that lowers cholesterol. And they're very good at marketing and they have a very big budget to market. So when you have billion-dollar advertising budgets, you can pretty much put out whatever kind of message you want to put out. And so since they have so much money to put into this system, that all of the testing that's done, all of the science behind cholesterol is all goes around from their marketing department, because that's who pays for it. And if they pay for it, you're going to get what you pay for. So cholesterol, when you look at like studies done not by the drug company, then you find that the optimum cholesterol, remember, we don't care about normal. We don't care about normal. You don't want normal. You want optimal. So what are you going to live the longest? And there is some really good studies that have been done. One of them from Korea that was not paid for by drug company money was 12.8 million adults. This is the by far, it's 1,000 times more than any other than the closest other study. This is a big study. And it clearly shows that no matter what age you are, no matter whether you're male or female, there is an optimum cholesterol level, and it's 230. So everybody should be right around 230. If you're 210, that's okay. If you're 250, that's okay. But 230 is clearly the optimal. And every study has shown that is not funded by drug companies. So what should your cholesterol be? Well, optimal. You want it to be around 230. So people ask me, well, what can I do if it's 110? Then you have to, it's not that you have to do something about that. You don't have to like start eating cholesterol or anything like that. But what you do have to do is eat normally and avoid especially any drugs that would lower your cholesterol. So it's perfectly okay to have a cholesterol under 200. People who are eating like vegan diets, they're very high fiber diets, low fat diets, they're going to have a lower cholesterol. Partly because of their digestive system and their liver, the way the liver functions to make cholesterol for biliary bile fluids, for example, that help solubilize fat. You're not eating a lot of fat, you're going to make less of it. So all of that's okay. So it's not that you have to be at that 230. It's that if your cholesterol is 230, you go, oh, this is a good thing. Now, having said that, it's not that simple. there's more to the picture than that. Triglycerides are actually the fats that you burn for energy. Cholesterol is a protein. It's a lipoprotein. It's a protein that holds on to fat. So they're very different. And triglycerides, that's the fat that you burn for energy. And if that's high, that means you're not efficiently burning fat for energy. So then you have to ask the question why. And most often it's because of insulin resistance. Insulin is a hormone that tells your body, do not use fat for energy, store it. So insulin causes you to gain weight and decreases your energy production because you can't use fat for energy. And fat is normally 60% of your energy. 40% comes from glucose and 60% from fat. And if you decrease the amount of fat you use, you just have less energy. So if you're feeling fatigued and you're feeling weak and you check your triglycerides and they're over 150, then it's very likely that you have insulin resistance. And if you get your insulin resistance down by using the diabetes solution kit, would be a great idea. That really works. Then improving insulin sensitivity allows you to then start burning fat for energy, and your triglycerides will come down, ideally below 100. And at the same time, your HDL cholesterol, which is the good cholesterol, it's not that it's good, it's that if its ratio is about half of your total cholesterol, then that's a really good sign. That means that you're very efficient at using this cholesterol and fat for energy. So your cholesterol to HDL ratio ideally should be less than 4 and is even better if it's less than 3. So that's the way to look at it.
Interesting. Okay. All right. Next question. How about blood pressure? Where should that be?
Okay, so blood pressure, it depends on your age somewhat, but the best way to look at it is your diastolic number. The diastolic is the lower number, and that should be optimally right around 75. It could be a little lower than 75, a little higher than 75, so like between 70 and 80 is okay, but dang, the optimum place to be is right around 75. Interestingly, if you're younger and you're male especially, the optimum systolic blood pressure is around 120. But as people age, especially if they have atherosclerosis of any kind, they want to be over 140 or right around 140 becomes optimal because they need that for circulation. So think of blood pressure in terms of the amount of pressure that you need inside your arteries to maintain your circulation. If the brain is saying, I need more blood flow, then the brain is going to tell your blood vessels to constrict and push blood up to your head. And that way the brain gets more blood flow. If the kidney is saying, I need more blood flow, then the kidney is going to increase a hormone called renin, and cause more flow, cause your blood pressure to go up to get more flow into the kidneys. So, looking for why your blood pressure is elevated, what's missing, what's not getting enough blood flow? Is it your heart, your liver, your kidneys, your brain? What's not getting enough blood flow to raise your blood pressure? Or is it stress? It could be adrenal glands, it could be pituitary glands, it could be hormone imbalances, thyroid and other hormones. So, looking for the underlying cause and fixing the cause. I had a woman in here just today. She has something called Addison's disease. I'm sorry, Cushing's disease. Cushing's is too much cortisol, and this too much cortisol causes her blood pressure to be high. And so she thought that, well, we know what the cause is. It's the high cortisol, so I don't need any blood pressure medication. Well, that's not the issue. The point is she needs to fix the problem. She's got to get that cortisol down to normal, or else it's going to be a problem.
So how often, okay, well, first of all, there's a lot of questions about blood pressure that have come in, you know. So at one time, I think you had said maybe as you get older, 140 systolic was okay. Was that right?
Yeah,
Okay. And then 75, maybe.
75 still stays the same.
Okay. So what if someone had, Edgar says his is 100 over 60, Susan's is 114 over 60. What are your
Yeah.
thoughts about that?
Okay. So blood pressure goes up and down according to need. When your body needs more circulation, your blood pressure will go up to increase that circulation. When you need less circulation, it will go down to where you have just the circulation you need. So the pressure is going to change continuously. That's perfectly okay. It's okay. In fact, it's very normal if your blood pressure goes up to 180 over 100 when you need that amount of circulation. And then when you don't need as much circulation, you're quiet and relaxed and sitting there and it drops to 110 over 60. Okay, that's fine. The point is that it needs to come down when you're quiet and relaxed and not needing any extra circulation. So if you measure it when you're quiet and relaxed and it never comes down, it's always elevated, you need to know why. So you need to know, is it a Cushing's disease? Do you have adrenal problems? Do you have kidney problems? Do you have brain problems? Where is the circulation insufficient that your blood pressure never comes down to normal? It should come down.
Interesting. Okay. So, do you recommend that people have their own blood pressure cuffs, or I see there's a wrist kind of monitor now. Is that a big deal?
Um, yeah, well, I recommend people who um, have been diagnosed with hypertension or have had hypertension. So if their blood pressure has been elevated, then they may need a cuff at home to be able to say, what causes my blood pressure to be elevated. So usually the first thing I do when somebody comes in with high blood pressure and they want to get off medications, for example, first thing I do is I have them measure their blood pressure twice a day on their medications. And then they go off their medications. They continue to monitor twice a day. Why twice a day? Because the adrenal glands put out a whole bunch of cortisol in the morning and it goes down to essentially zero at night. So in the morning, you expect to have higher blood pressure than in the evening. If it's reversed, then that's telling us something. If it's really high in the morning and low in the afternoon, then that's telling us something. If it's high all the time and doesn't change, then it might not be related to that at all. And there's some other thing that we need to look for. So that's just a simple way of monitoring and looking at what are some of the possibilities of why the blood pressure should be elevated. I had someone yesterday who had been monitoring for a couple of weeks, and he said didn't have a blood pressure cuff, and then he went and got one, and he sent it to me. He said, "Wow, my blood pressure is normal actually. Every time I go in the doctor's office, it's high, but look at this." And he showed me every single number, morning and afternoon, were all normal numbers.
Yeah, and I think it sounds like it's pretty common that when you go to the doctor, it's going to be elevated. So be watching for that. Okay, we have a lot of questions that have come in. And let's see, Shannon. Hi, Shannon. She is asking, do you need to get A1C checked, or is it just good to track fasting numbers over time?
Um, well, you need to get A1C checked periodically at least, because if you're just checking fasting numbers, well, that's going to tell you, that's going to give you a good indication. Yeah, um, do you need them? No, you can do without them. You could manage to uh, know what's going on, whether you're insulin resistant, just by checking the fasting morning glucose.
Okay. Shannon also said lettuce wrap burgers are delicious. That's actually what I was thinking.
See,
And
there you go.
you can get those in a lot of restaurants. If you're in a pinch, they do have those available, or even some fast food places. Keep that in mind. Not that you want to go do fast food every day, but they do have those options, which is a good thing.
I had one once. It was pretty good. I
Yeah.
enjoyed it.
Yeah. All right, let's see. Richard says I'm 75. 2 years ago, my A1C started at 7.4. It's probably around 5.6, 5.8 now after going on a low carb diet and using the supplements. And I've lost 45 pounds, but now it hurts to sit down. I weigh less than I did 50 years ago. Trouble is my blood sugar 90-day average has gone up from 108 to 100 to 115 to 120. I ran out of Cinechroma and started taking 4 tablets of Ceylon cinnamon, and I started taking L-leucine to stop the muscle loss. Is the change to Ceylon cinnamon and leucine causing my blood sugar to increase? Do I need to see an endocrinologist?
Huh, interesting. I don't know why the Ceylon cinnamon would do that. It should help lower it. Leucine, though, is an energy source for muscles. It's a branched chain amino acid that's used as energy. And gosh, I don't know specifically if that will affect blood sugar, although it may prevent you from using the glycogen in your muscles and could cause or could increase or contribute to insulin resistance. So I don't know. It's possible. Okay. So what to do in this kind of a case? Well, go back to the phase one of the program and use up the glycogen in your muscles and exercise. And in that way, you can improve your insulin sensitivity instead of relying on pills, supplements, or whatever to do that. Do it with your diet. It's so much better and so much better for you.
Yeah. The other thing I was just thinking, you could be one of those people who really does need chromium that you were getting in your Cinechroma that you're no longer getting. Sometimes that makes a difference. I think we have had people experience that too, but the diet's the easiest and cheapest way to test first. Okay. Mary says, does exercise increase cortisol as well as use up glucose? I find that my blood sugar measurements remain about the same before and after a couple hours of mild exercise, like pickleball or walking. I haven't tested it after vigorous exercise.
Mm. Yeah. So in the immediate sense, the glucose is can be elevated because cortisol does get elevated with any kind of stress. So you're out there exercising and you're creating physical stress, which will increase your cortisol levels as well, and somewhat allows insulin resistance. But what's really interesting is that the muscles, when you're exercising, don't need insulin to bring sugar in. So they have another way of bringing glucose into the muscle cell without the use of insulin. So even though you have insulin resistance, when you're exercising, those muscles can use glucose from the blood as well.
Okay. Shannon says, so at 55, as a woman, what should my blood pressure be?
Okay, so 55 as a woman, your blood pressure ideally should be 120 over 75. That would be And the range is variable depending on the individual. So that's kind of a starting point. So if you were 130 over 80, that would be okay. If you were 110 over 60, that would be okay. So having that range would be fine.
Okay, and when does the 140 kick in that you had mentioned?
Over age 70, in people that have some atherosclerosis.
Oh, okay. All right, Sib says, as we are aware, prunes are often praised for constipation. However, I just saw an article stating new research suggests that when eaten daily, it may help improve cholesterol and fiber and also reduce inflammation. It states that it's most effective in men over 55 years old and postmenopausal women. Any truth to this?
Oh, absolutely. Yeah, anytime you're adding fiber to your diet. So in this case, the fiber has several different benefits. And one is having regular bowel movements. And then another one is when you're getting fiber, that holds on to cholesterol, it drops your cholesterol. It improves the bacteria in your intestines, lowers inflammation. And so just that one fiber, and prunes especially, because they're concentrated with a certain type of fiber that these type of plums have. So yeah, absolutely.
Okay. How high should your blood sugar rise after eating?
Okay, it should not go over 120. If it goes over 120, then you have insulin resistance. Ideally, it should not go over 110. So there's normal and then there's optimal. And so optimal should stay between 70 and 110.
And so Elaine had said, then what should your morning glucose number be?
Okay, so the morning glucose should be between 70 and 90.
And Kimberly says, speaking of cinnamon, what is the best to use?
Well, um, let's see. I think it is the Ceylon cinnamon that has more.
I feel like this goes back and forth all the time. I can't.
Yeah, it
Yeah.
does.
Yeah.
Yeah. I don't know if there's one cinnamon that's best to use. You know, the best thing to do is still to use your diet to control and manage your blood glucose instead of taking pills because yeah, that's what I
Yeah.
think it'd be better.
Let's see. There was a message here. Actually, I think I got that one already. Yep, I did ask that. Terry had asked, how do I get inflammation out of my body?
Okay, this is a big question. We have a whole webinars on this that we've discussed different types of inflammation. So it depends on what type of inflammation you have. The best way to look at inflammation is look for the source. Where does the inflammation come from? If it's autoimmune, then it's going to be way different than if it's toxic. There's a whole bunch of different reasons why you could have inflammation. Some people have very high omega-6 and very little omega-3. Omega-6 causes inflammation, omega-3 suppresses inflammation, and you need equal amounts so that you can get inflammation when you need it to get rid of infections and heal things and get things done. And then you also need to be able to suppress that inflammation when you don't need that anymore, when it's not useful and causing damage to tissues. So the evidence shows that having an equal amount of omega-6, omega-3, that's another test that we could have talked about today, is what's your omega-6 to omega-3 ratio? And the average American is between 10 to 1 and 20 to 1. That means 10 times more omega-6 than omega-3. And if you look at other populations, like the Inuit in Greenland, that have more omega-3 than omega-6, or the older people in Japan, on some of the islands of Japan where they live on a lot of fish, cold water fish, they also have more omega-3 than omega-6. They have very little heart disease. You know, their inflammatory markers are super low. They have 1/10 the amount of heart disease per capita as the United States, which has, you know, the high omega-6, omega-3. and there's a correlation there, but we don't know about causation. We just know that it correlates pretty well no matter where you go in the world, no matter what people you test. If they have um, a good omega-6 to omega-3 ratio, they have low heart disease. If they have an imbalance with high omega-6, they have a lot of heart disease. And heart disease, we know, is caused by inflammation. So that's an important thing that we often don't talk about, that would be a good test for you to do. What's your omega-6 to omega-3? And then looking at other sources of inflammation, do you have an ANA positive, anti-nuclear antibody, which is an indicator of autoimmune disease? And then you look at your inflammatory markers. Is your sedimentation rate high? Is your C-reactive protein high? CRP. Those tests are going to give you the indicators of inflammation and then kind of tell you where that's coming from.
Interesting. Okay, what did you say the ratio should be?
1-to-1 is optimal. It's really hard to get 1-to-1 because the only sources where you're going to get more omega-3 are 3 sources: fish, cold water fish specifically, fish and flax seeds and chia seeds. And that's it. There's like no other good source. Well, okay, wait a minute. I take that back. That has significant amounts of oil. So broccoli has more omega-3 than omega-6. But it would take, I forgot what it was, a pound of broccoli to get a gram of oil. So so you have to eat a lot of broccoli to get that much oil. But yeah, there is more. So people who eat like vegan diets, if they're eating good food like lettuce and spinach and celery and broccoli and cauliflower and Brussels sprouts, if they're eating a good vegan diet, they can get a lot of omega-3 and have a really good omega-3 to omega-6 ratio without having to have like fish oil or anything like that. This could, and then get flax seeds and chia seeds too.
I was just trying to look at, we had some messages here from Julie on YouTube. Fish oil is good because the fish eat the plant omegas.
That's it.
So
Exactly.
we also have a really good product too, our Omega product that is available to you. And you can find that at bartonwebinar.com. Use code webinar25. What about spirulina?
Spirulina, as far as like for the omegas,
Well,
it's
might
not a
be,
good source of omegas.
yeah, I'm not sure what that was in reference to, but maybe is it just good for you in general? Maybe we're talking about
Yeah,
cholesterol.
it's pretty
Okay.
nutritious, and it's also a reasonable heavy metal detox. It holds on to heavy metals and doesn't let you reabsorb them, so you excrete them out. So
Yeah.
it helps you get rid of heavy metals too. So
Okay.
spirulina, blue-green algae, um, yeah, algae, good.
All right. Can inflammation cause plaque in the arteries?
Yes, absolutely. So plaque in the arteries is caused when the glycocalyx, the lining inside your artery, is damaged. And that damage is definitely increased with any kind of inflammation. It's so broad and general that you can't say this type does and this type doesn't. People who have gum disease get heart disease at a much higher rate just from the inflammation in their gums. So any kind of inflammation is going to affect your vascular system and cause things like heart disease and strokes.
David had said, what test do we ask for, to get the omega-6 versus 3 levels? Is that a common test? I mean, do most doctors do that?
Most doctors don't. You can get it like the Cleveland Labs does a heart test, and some doctors, especially cardiologists now, are doing the cholesterol tests that do all the lipids. So they're doing cholesterol and lipids, and they actually look for the omega-6, omega-3 ratio. I usually do what's called a NutriVal from Genova Diagnostics, and that has it on there. But local labs like Quest has essential fatty acids test. And so you just tell them you want an essential fatty acids test, and that can be done in any lab.
Sib said, is there a triglyceride? Is a triglyceride of 40 good? I also do 3 tablespoons of chia each day.
Wow, a triglyceride of 40 is great. That means you're using fat for energy. You're not building up triglyceride levels in your blood. That would indicate that, you know, your heart is going to have plenty of energy. You're not going to go into congestive heart failure. Your kidneys are going to be spared. Your liver is going to work well. You know, things will just have energy to function well at a triglyceride of 40. That's really good. And so actually there's some parity. You want about equal number if you have your HDL and triglycerides. And if the HDL is a little more than triglycerides, that's okay, and that's even better. So that's another part of that lipid panel that's really useful to look at. And so if you want to do something that's going to affect your health on that lipid panel, don't listen to the cardiologists, the doctors that are telling you what to do, because they'll look at total cholesterol and LDL, which are kind of like unimportant and they don't affect your health that much. The ones to really look at that you can do something about are the triglyceride and HDL. And you can increase your triglyceride or decrease your triglycerides, improve that ratio by increasing fiber intake and decreasing insulin resistance.
Okay. Sib had said HDL is 80.
HDL is 80. Wow, that's great. So your LDL or your triglycerides are 40 and your HDL is 80. That's a 2-to-1. And you know what? In women, that's an optimum place to be. In men, it's really hard to get men to that position. But so men, they always look for a 1-to-1 ratio. But that's great.
All right. Okay. Catherine said I'm 74 and doctor told me my high blood pressure was because I'm getting older. Is that true?
Okay, so no, it's not true. Don't blame anything on getting older. So getting older means that you have a problem that you haven't dealt with over a long period of time and it's getting worse. So it's not because you're getting older, but it's because your problem is getting worse. So deal with the problem. So if your blood pressure is going up, ask the question why. So is it getting worse over time because you're getting hardening of the arteries and they're not working as well? So what do? Well, you have to improve that by getting your arteries functioning better. And that's why we have the Healthy Heart Solution Kit. The Healthy Heart Solution Kit idea is to get your arteries functioning well so that your blood pressure can go down and your heart disease rate goes down and all of that. But to look at other possible causes as you're getting older, what else can happen? Well, you can have increased adrenal output. You can have a lack of nutrients. There are certain nutrients that are necessary for dilating the blood vessels. If you're not getting enough protein, then you might not have enough arginine. Arginine is necessary for relaxing the blood vessels and allowing the blood to flow properly. So finding out the underlying cause, why is the blood pressure elevated? Is it a kidney problem, a heart problem, a brain problem? Because if your brain's not getting enough blood flow, it's going to raise the blood pressure to say, hey, give me more blood flow. And so you have to see if it's your brain too. There's all kinds of reasons. So find out the reason and don't take, I'm just getting old as an answer.
All right. Anonymous said benefits of black seed oil and the best way to take it. Oil versus capsules.
Okay. Black seed oil. Okay. I did some research on this and it's not for everyone. I actually have somebody on black seed oil. But one of the issues that I have with it is it's pretty high in omega-6. I know that's not the only oil. It has some omega-3s and some oils, some other triglycerides in it, and that's okay. But um, it's just that I see most of our problems in our society are associated with high omega-6. And so I try to keep people off omega-6 oils if necessary. Now, I've done tests. I actually test people's essential fatty acids, and some people need it. But I would say test first.
Okay. Judy said, do you have to ground up flax seeds and chia seeds in order to absorb the nutrients?
Um, yes, yes. So you have to either chew them or you have to grind them. And so some people put them in a coffee grinder, some people put them in a blender to grind them up. And like put them in a smoothie and blend them up. And that works pretty well. And it's best not to get the oil because the oil, omega-3 oils oxidize pretty quickly. And so it's better to get the whole seeds and then grind them just before you use them. That's a better way to do it.
Okay. Elaine says, what do you do when there's pushback from a doctor in regard to tests? I'll answer, find another doctor. No, I'm just kidding. I'll let Dr.
Okay.
Saunders answer.
I actually had that today where somebody came in and said, but my endocrinologist won't do the tests that I need. The endocrinologists don't want to do like a hemoglobin A1C. No, they'll do the hemoglobin A1C, but they won't do the insulin test or the C-peptide test. They go, you don't have type 1 diabetes. We don't need that. And so they won't do the test. So I end up doing the test. So what do you do? There's several ways to handle that. One is to try to convince them that some people try that, and some doctors are open to it. And they go, okay, well, if you insist, I'll do it. Other doctors are absolutely not. It's my way or the highway. So you can find another doctor. That's what Leslie suggested. But you can also have online tests, and in most states, you can walk in, order an online test, walk into a lab, get it done, and
Yep.
that's another way to do it.
All right, last question. Michelle says, what if I grind flax and chia and then freeze it so I don't need to grind it daily?
Yeah, that works. That works. When it's very cold, especially if you put it in maybe a Ziploc bag or something where there's not a lot of oxygen in there, because in the freezer, the way frost-free freezers work is they put hot air in and melt all the ice off, and so the ice drips off, and then they freeze it back up again, and so they're alternating between hot and cold on the outside at least. They don't give it enough hot to thaw out your whole steak or whatever. But they are doing a sort of a freeze thaw on there, and they thaw it out so that they can get rid of the frost. So and that's fine if you put it in something like a Ziploc bag that doesn't have any oxygen or air in there. That might work well.
All right. Anonymous said, Dr. Saunders is right on. I'm 68 years old. Last year, my blood pressure was averaging high. I got the Healthy Heart Solution Kit this year and follow religiously. My blood pressure average is now normal, and it has been for months. Yeah.
Wow, good work.
That is
Thank you.
awesome. Okay, I think that's it for today. Mary said, did you say that flax seeds are one of the only three foods high in omega-3, but flaxseed oil is high in omega-6s?
No, flat. No, that was black seed oil.
Yeah.
Yeah. So that's different.
BLACK.
Yeah, yeah. So yeah. Flaxseed oil is okay too, but it does oxidize, and so if you buy flaxseed oil, they'll usually put a vitamin E in it to prevent it from oxidizing, and that's okay. And so something like cod liver oil, for example, is really high in vitamin A. That prevents it from oxidizing. So you can get those as oils. Oh, that's another source, by the way. I didn't talk about that. It's cod liver oil.
Yeah.
Yeah.
Okay.
But that's fish oil too, right?
Yeah.
Yeah.
All right, Dr. Saunders, thank you
Right.
so much. See you next week.
Okay.
And thank